I'm posting the meeting online. We are going live on YouTube. It's our channel. I'll send you the link. Perfect. Dipesh?
Yes. Anna.
Hello.
Yes. Anna.
पार्टिसिपेन्ट्सहरूलाई पनि एडमिट गरिरहेको छौ?
अब सुरु गरेँ मैले एडमिट गर्न।
ए अघिदेखि आइरहेको थियो रिक्वेस्ट। So
मलाई एकपल्ट सेयर गर्न दिन्छौ स्क्रिन? Host has disabled participant screen.
Just a second.
को होस्ट दिनु न दाइ, दुवैजना स्पिकर।
Did you get it?
Okay, that's good.
Yeah.
How's my connection so far, okay? You can hear me properly? All right.
It's perfect.
Good. So I'm supposing everything has to be done in English, right?
Yeah. We should.
Okay.
From some participants from outside. So we'll wait for like 4 minutes. We start in 4 minutes. Is it perfect?
All right. How are you doing the question answer session? People are going to directly ask, or are they going to ask in the chat room?
They will ask in the chat room and I'll moderate. Like I'll forward those questions to you.
And there's a separate question and answer, right? Not after the presentation, later.
Yeah. I mean, we just talk about the questions during the webinar. Dipesh, can you also share the YouTube live link on Facebook if you can?
Sure.
So everyone else, we are starting in 2 minutes, so please be patient. Today we are, let me introduce our organization, Nepalese Space Research Association. So Nepalese Space Research Association, NESRA, is a youth-led initiative. We are trying to promote space sector in Nepal by organizing National Space Meet. That's our annual event. We organize it every year to assess the situation of space industry in Nepal and how progress can be made. So we discuss all these topics during this NSM. So it's called National Space Meet. And we also organize analog astronaut missions in collaboration with international organizations. So if you want to be a part of these missions, please contact us and please get in touch. And we also organize technical workshops and just to build skill sets for the young engineers in Nepal, engineers and young professionals, basically. So we organize all this stuff, and you can be in touch. We also started recently our newsletter. So we published our first newsletter a few days ago, and we also started the membership drive. So you can get involved, get in touch if you are interested. And let me introduce you to Abhas Maskey, who is our next speaker. Mr. Abhas Maskey, he was the board's 3 satellite project manager. It's also called the Nepali Sat-1. So it was the first satellite of Nepal. So I think this is a very important role which Mr. Maskey had. And basically this satellite launched Nepal into the space era. And he will talk more about the practical use of satellites for effective disaster management and response. As we know, a satellite disaster management from satellites can be very effective and can save a lot of lives. And we have active UNOSA presence in Nepal. So I think satellite project managing satellite disaster management is really important. And Mr. Maskey is going to talk about it more. We cannot hear you. Can you hear us, Mr. Maskey?
So let me just start with the presentation since you have already introduced.
Sorry, there was a little disturbance on your side.
So for today, I'll be talking about a couple of things. We'll start with the disaster response. These are all the agenda for today. And in disaster management, you have a disaster management cycle, okay? So what you have is you have a preparedness, and then you have response. These are basically reactive. So before you prepare, and then a disaster occurs, and then you start the response, right? And from response, you have recovery, and then you have mitigation, and then the cycle continues. What you see in case of Nepal is that we are more geared towards reactive rather than proactive. If you look at Japan, which is also a hot spot and a hot area for disasters, there you see a lot of proactive measures being taken. So let's look at the reactive aspect of it, okay, first. So let's say a disaster did occur. So you have to have time scale data, also called temporal data. You need to have a data before the event, and then you have after the event. Then you can start seeing what kind of changes have occurred, okay? Then you can measure the recovery later on. But what we'll focus on is these two. So Wired had this article about how Nepal's earthquake was mapped in 48 hours. I think it was a bit of an exaggeration, and I'll show you why. But there was definitely a concentrated effort to map in 2015's earthquake. So maybe a lot of people know, maybe a lot of people don't, but we had a 7.8 Richter scaled earthquake in April of 2015. And UN jumped right in and were supporting the mapping at the time. So even if Wired was reporting 48 hours, you will notice here that the earthquake took place, and these are all the satellites that supported at the time. These are big satellites, obviously. But you'll notice that there is quite a delay. Like you had earthquake in 25th, and then you had Digital Globe providing data. Then you had Worldview. Then you had Landsat. So I'll talk about this delay in a while, but you can see that this time is very critical. You want as much data as possible. So let's say we do have that kind of situation where an earthquake occurs, and you are a national or an international organization in Nepal. So there's this wing called UNOSAT. They are responsible for satellite utilization in UN. So what you can do is you can request them by either a call or by submitting a form. And then they look at it. They say whether it's valid or not. And then they then trigger the International Charter for Space and Major Disasters. This charter is basically formed of all the government space organizations in the world, and also a few private companies like Planet, which is a very interesting company. And then you have Digital Globe. You can also directly request data from these private companies if you want, or coordinate directly with the charter. But most of the data is being flowed through UNISAT, and then from UNISAT goes back to those international and national organizations. So that's the flow. Okay. But let's talk about small satellites, specifically CubeSats. Small satellites, you see, it's almost like a coronavirus graph, but yeah, so we can see that it has exponentially grown over the years. And we continue to expect that as more constellations are launched. So what are CubeSats? CubeSats are basically nanosatellites. The basic form, let's say, is a 1U. This is a 10 by 10 by 10 centimeter. Nepalese Sat 1 was a 1U satellite. But if you need more resources in the or space in the satellite, then you can stack it up like bricks and make it bigger. So if you have a 3U satellite, which you can still hold it in your hand, you can then start taking these kind of really interesting images, which is 5-meter resolution. Now, these are important images that you can take. This was right before the earthquake that Planet took. And the more important aspect is the daily revisit time. Remember that I talked about how these satellites actually don't come to the same position every day, right? So during disaster, you need satellites to be coming over your airspace every day so you can monitor. And these small satellites allow that because you are launching more constellations and more satellites. So there's this new wave starting all over the world about making small satellites. And there are new space actors here in Japan as well. We have some friends here at IQPS and Exospace. They are making active and passive sensored satellites that do remote sensing. And now the new wave has also come towards machine learning. Okay, so you have constellations of satellites with a lot of data. And then with that data, you can start doing a lot of analysis. And this one is from Planet. Then you can start seeing how the landscape changes after an earthquake. So that is a landslide, right? So you have a pre-disaster event, and then you have the event itself. So what you can do with machine learning models is you can classify. You can take an image, you can feed it into the model and then classify. You can classify into buildings, surface, tree, so forth. But later on, you can even classify damaged buildings, not damaged buildings, and so forth. Now that's very useful. This one is using an SVM model, support vector machine, which is a traditional method. But state of art is a convolutional neural network. Right now, there is a wave coming into deep belief networks as well, autoencoders as well. These are all deep models that you can use for image classification and segmentation. Practical use, just an example, not that we have this kind of model, just an example would be, you have this kind of data. This is from Kathmandu. You feed it into the trained machine learning model, and then it will tell you with 90% certainty that there is 105 tents. Now, if you know 105 tents, then you can calculate how many people are there. Then you can allocate resources. I think this is a smart move because you don't have to start counting. All you have to do is feed it in the model, and immediately it will tell you how many tents. Immediately you can start allocating resource. Okay, similar with landslides. So I think this is going to be a game changer. Now, we talked about landscape changes. We also have to talk about communication. And amateur radio, satellites, they play a really active and important role during these kind of disasters, especially for rescue efforts and information inflow and outflow. We have Satish Karel, Mr. Satish Karel, and he was active at the time. But what he did was he was talking terrestrially. So he was talking from one ground station to another ground station directly, right? But what we're going to see is talking to space. So Q0100 is a satellite launched by Qatar. It's a geostationary satellite. And this October, when I and a friend from Thailand, who's an expert here for ground stations, when we went back home, we installed the uh, this kind of ground station antenna so that you can talk or you can transmit voice data and then can be received as well. So all you need is backup power and then the ground equipment and radio license. And if you have that, and if the geostationary satellite has coverage over your country, then you can start talking, okay? So this was installed in Satish Kharel's home. And another way is to use a digipeater, okay? So digipeaters are basically these small packets that you can send all the way to space and can be then repeated back to Earth, okay? So you can say hi or you can say SOS with your GPS location, and then you can ask for help. Now, these kind of packets can be sent to International Space Station. You can also send it to small satellites like a CubeSat, and you can see that pico satellites or pocket cubes can also actually utilize them. So you need a ground setup, and then you can start sending data. So that was for disaster response. Let's look at airborne tracking. So I read this article in New York Times about how drones are delivering vaccines. A company called Zipline, and they deliver these kind of packets to remote areas, right? So I think these technologies can be quite useful in Nepal as well. So basically you have a drop zone, and then you can drop PPEs, you can drop COVID-19 test samples, and in the future, probably vaccines as well. So, but the most important thing is to keep track of these drones because of regulations, because of other things, and making sure that your important samples, important vaccines are delivered on time everywhere. Okay, so the way you would do that is by using Iridium. So this is an example. You have a transceiver, you can place it on the drone. You have a small antenna that's faced towards the space. And from the ground station, which is connected to the antenna here, which talks to the satellite, and then the satellite can then control the drone. Actually, if you put a waypoint here, the drone flies. So you have access to or control of the drone wherever you are, and you have a reliable, extremely reliable telemetry tracking and command. And the only limitation here would be, of course, the drone's batteries. Now, that's another issue. Dr. Shrestha's paper actually talks about this, especially with the regulation issues. You can read it if you want to. And okay, so this one is another thing. We're talking about probably, let's say, aircrafts, right? So in Nepal, we have mountains, and there's a good chance that accidents can happen. And this is a new technology that's been implemented recently. I think it was tested maybe 2013 or so. First payload was from ESA and European Space Agency. And the Germans actually designed the payload at the time, DLR. And from there, they tested it in space. They were receiving packets from planes. Not all planes have these transponders called automatic dependent surveillance broadcast, but 80% these days have it. And by, let's say, 2020 to 2030, most of the aircrafts will have these. So this is a new generation of tracking system for aircrafts. And before, these were basically sent to the ground station on some kind of flat land, and then send it to a server, right? Now, let's say places like Nepal or sea, like you could have floating ground stations, but those are incredibly difficult to maintain. And these surfaces are very dynamic, I would say. So satellites are the best option, right? So satellites can talk with each other, can relay that information back to the ground station, and from the ground station to the server. So Iridium network can actually help with that. A practical example in Nepal would be to utilize for search and rescue. And let's say in the future, because of economies of scale, we could also extend it to road transport, because I think Nepal, although a lot of people fly, more people actually took road transport, and it's not a very nice place to be traveling on the road. So you have a lot of accidents. I don't know what happened in 1992, actually. There's a lot of accidents there. These are aviation accidents in Nepal. So let's look at disaster preparedness. One of the examples that I'm using here, which can also be used for floods, is glacier lakes, right? So because of global warming, as they say, it's warming up and glaciers are melting, and we want to observe how glaciers are getting bigger. And this is an example. Because of the amount of water, it can actually, there's a natural dam, so that dam can explode, and that dam can lead to flash floods. So it's important that we use satellite data, especially temporal data, to monitor these kind of lakes. And if, let's say, RGB, the problem with RGB data, or is red, green, and blue data, or let's say reflective data, is that clouds can interfere. So in that case, you can use active sensors like synthetic aperture radars to be able to map. And in this case, especially during flood season, during monsoon season, you can use these to map the river itself. Okay. Another way is a thing called store and forward. So store and forward, you have this new hot thing called LoRa. It's called low powered long range transmission. So you not only between the satellites, but also using remote ground stations. So if you put a remote ground station, which is low powered, you can have a depth sensor, then it transmits data continuously, and then you can store that data onto the satellite. The satellite then moves to another ground station. Then the data is transmitted there. So if we put in Nepal, we can get it in Japan as well. Okay. Weather forecasting. Himawari is a Japanese satellite, and I realized Nepal actually uses that, but I think there's a lot of potential to utilize it further for weather forecasting. I think it's very preliminary stage in Nepal. So let's look at disaster prevention. So when I say disasters, there could be diplomatic disasters as well. So this was a recent dispute in Nepal, a border dispute. Let me see if I can play this. Pointer options. Okay. So what you'll notice is these roads. Okay, these roads are going to Lipulekh. This is a 5-meter resolution from that small satellite image that I was talking about. And around maybe 2019 January, you will start noticing that suddenly the roads are a little darkened. So the construction actually began there in January 2019. So this is a disputed area, and roads are not supposed to be built. Okay, so you can start doing that too. Another one is political disaster. For example, the government need to ensure that some projects is going on well. This is Pokhara International Airport. You can see when exactly they started working and how much they have completed. So this kind of temporal data is incredibly useful for such things. Okay. So these are practical examples. And in investigations, you can use it for journalism and investigation. I think I'm crossing my time limit here, so I'll just skip this. So if you want to learn, you can use Python and use open source data and then analyze. So just as a Nepali Sat1 mission philosophy, what we did was we looked at the earthquake, and we knew that communication was an issue. Remote sensing had to be done as well. So we put payloads like that. So we took the first steps, like we took an image of Nepal. Okay, that's good. So we want to do store forward. We can send command, it stores a message, and then it beacons the message back down. So we are currently using for COVID-19 to honor the people who are working. And also we have demonstrated LoRa on orbit. So it's working for 1 year now. So these are all the images that we have taken. And we release images every Friday, okay? And currently we're working on a Burst 3 journal. Thank you.
Thank you so much, Mr. Maskey. It was a really interesting presentation to know about Bird's 3 satellite project and what is it doing and how can satellites can have application in so many different sectors. So thanks a lot. And if you have any questions, you may ask now to Abhas, Mr. Maskey. If anybody has a question, you can send it in the chat box and I can convey the question to the respective person. So meanwhile, we can also start with the next presentation. If nobody has a question, I don't see any questions, but I do have some questions. Maybe I can go first. So,
Okay.
Do you think we can fetch more satellite images by help from international organizations like UN Spider? You know, they have various channels where we can use our status of a developing country to get more satellite images in a more cheaper price, maybe, or maybe
Yeah,
because
definitely. I mean,
in 2018.
yeah, so
Yeah.
definitely we can do that,
So
especially.
UN Spider normally organize workshops. Yeah, sorry. Go ahead, please.
Hello.
Is there a lag?
There
Hello.
seems to be a
I'm just
lag.
saying. Yeah. So maybe we can. You can tell us how international collaborations can help us to
Okay.
achieve more disaster preparedness and mitigation. Yeah.
So I think one thing you mentioned was how can we get more data, right? I think that's very important. So Planet shares all its data that it's taking every single day to NASA. That's what I know. Planet does
Yeah.
do that. So let's
Mm-hmm.
say some organization in Nepal makes a deal with NASA or asks for the data. I think it's possible to receive those. So without paying, I think that's possible. But I think with higher sub-meter resolution data, those are a little difficult to get, of course, unless you have disaster, unless the charter is triggered. That's going to be difficult. But I can see up till 5-meter resolution or 2.5-meter resolution, you can get it. And that's also very useful, those data. Yeah, those data are very useful.
Yep. And I'm talking about the drones you talked about in the during the presentation. Like I also saw that video last year, and they're really doing great work in African countries to deliver emergency medical supplies to those who are in need right now. So it's really good idea, and we also thought about these implementing these ideas in Nepal. But what do you think about the wind problems? Because
Yeah, one is a lot of, I think you have a lot of issues with regulations. Number one, it's difficult to work with the government. Number two is you cannot use fixed wing. I think fixed wing is very difficult to use. So you
yeah,
still have to rely on, let's say, quadcopters. Fixed wings, you can use it probably in Thai area, but yeah, you'll probably have to use drones, these kind of quadcopters. Now with quadcopters, the problem is the range because of the battery. With fixed wings,
yeah,
you can fly quite a lot, but with drones like this, it's difficult. So you need stations, probably, small stations located at a particular area, of geographically good area, to be able to fly these drones. But definitely there are challenges, sure.
so yeah, I think the one we have a question in the chat box. It says um, LoRa versus nanosat. Which one do you think is more reliable for a country like Nepal?
Okay, so LoRa basically is, okay, so I think maybe this was a misunderstanding. LoRa is a payload in the satellite itself, okay? So LoRa is built into the small satellite. So it's not like it's a different thing. So Nepali Sat-1 also has a LoRa module inside, all right? So what you can do is you can transfer that data to the satellite, not to Nepali Sat-1 right now. We just tested it in space. But in the future, these kind of satellites already have LoRa transceivers, can receive it, and then can transmit it back, can talk to other satellites. So I would say that since LoRa module can be placed on small satellites, and they are small and they consume less power, it can also be used for ground stations, remote ground stations. So there's a huge potential for it. Mm. So we are already building transceiver modules for LoRa right now. That's an active research.
Perfect.
I'll interrupt. Sorry for the interruption. Hi, Maskey. So I wanted to know I was talking about a LoRa mesh. I mean, like if we have ground stations and mesh system for the LoRa versus the
Okay.
nanosat that recently you guys have deployed, like which
Uh-huh,
one do you think is more reliable in context of Nepal?
Okay, so do you mean pre-disaster or post-disaster? I think post-disaster, I'm not sure if it will be reliable. Pre-disaster, probably yes. Post-disaster, it's difficult to say because it's low-powered. You could actually just rely on terrestrial LoRa too, but these are complementary. It's not like you want to compete with each other. It is complementary, meaning it's supporting the terrestrial infrastructure. Anything with satellites is complementing terrestrial infrastructure. So you have to look at that way. Okay. So if some part of the terrestrial infrastructure is down, then you have the satellites to relay that information. All right. Does that answer your question?
I think to some extent, yeah.
Okay. So you're not happy with the answer, huh? All right.
No, my basic concern is like to be honest, in Nepal we don't have any data acquisition systems so far, right? So should we be more focusing into data acquisition through nanosats or ground-based LoRa mesh systems?
Data acquisition, meaning what kind of data acquisition? Well, I didn't understand the
Like
question
right
properly.
now we were just talking about how we can have this geographical data so that we can compare that after like if we have data in hand and there's some disaster or some changes, we can compare these two set of data to come to a conclusion, right? So
Okay.
but we don't have that system so
That
far in
data.
Nepal. So
Okay. Okay.
since we are
Right.
developing in that field, which way should be more focused? Like, yeah, maybe like you
Right.
said, we
Yeah.
should go in the both ways so that they complement
Okay.
each other. But
Uh-huh.
personally speaking, what do you think is more feasible and more focusable for a country like Nepal?
Terrestrial first. Sure. Yeah. Focus on terrestrial first. So I think you need to have base infrastructure first to be able to then say, okay, space and whatever. So if we need to do data acquisition through either space or terrestrial, I think it should be terrestrial first for sure.
Ah, okay. I just wanted to confirm that. Yeah, thank you so
Okay.
much.
Yeah. Yeah. No problem.
Perfect. Thanks a lot. And there's one more question. We can quickly try to answer it and we move to the next presentation. It's by Hideki Yamazaki. And his question is, in disaster situation, it's problem to distribute the rescue staff unbalanced, like the unevenness, of the support resources. Like for example, some places has a lot of distribution package, and on the other hand, other place has less rescue package. So do you think the satellite imagery can help this problem?
Yeah, so as I mentioned here, I think this will probably answer your question again. Let's say we have 3 images like this, okay? Let's say. And in one place, one image, it shows 105 tenths, another it shows 4 tenths, another it shows 1,000 tenths. Now you know by these kind of satellite data and by machine learning, oh, you really don't need machine learning. Okay, let's say humans count it and then say this many tenths, okay? Machine learning is just to make it faster. So if you say by looking at the satellite data, this many tenths in this area, then you can locate the resources proportionally after that. So I think you're right. In Nepal, the major problem in 2015 was the distribution of the blankets, the tents, the food materials, right? Supplies. So I would say satellites through these kind of data, by high resolution data, by able to by counting the tents and buildings, you can then allocate the resource properly.
Perfect, perfect. Maybe also we can like increase the resolution of the picture and like see more deeper and distribute according to these number of times in a much higher resolution.
So what's happening right now is that we have you have some neural network that can reconstruct images. So you give a low resolution data, and then
Yeah.
they can probably reconstruct it to higher. So I think the opportunities for machine learning in this scope is huge, actually.
Perfect. So thank you for the interesting session, Mr. Maske, and it was really interesting to hear your work and what you are doing and what is the Nepali Sat1 all about. So moving on to the next presentation, we have uh, Professor Reshma Shrestha, and she is an assistant professor in the Department of Geomatics Engineering at Kathmandu University, Nepal. She will be talking about application of geospatial technology, health disasters perspective, just selling and selling. So it will be a casual talk about how geospatial technology can apply to disasters and like it can be used for disaster preparedness and mitigation. So
Thank you. Let me share my. Thank you, Anmol. Can you hear me properly?
yeah, we can hear
Okay. I think good afternoon and good evening. I think the participants are from various, not from Nepal, but outside also. So let me share my slide first. I'm trying to share it. Mm. Um, can you see my slide here now?
yeah, we can see it.
So first of all, I would say welcome for this presentation, and the presentation from Abhas Maskey. It's very interesting. Thank you, Abhas. And very concise presentation about how satellite has geospatial technology has been focused in disaster, and basically had mentioned from the earthquake disaster and landslide disaster. But for my presentation, I will be talking a little bit still from the disaster, but it's a health disaster. And my topic is about application of geospatial technology from the health disaster perspective. I have said it just telling and selling. The concept itself is I'm selling and selling. It's a concept should be now, this type of geospatial technology now. I need to be sold from different domains, just like in health disaster as well. That's why the topic itself is it's a kind of geospatial should be now integrated in the health perspective as well. So this is the topic of my presentation. So it's I will be presenting here as from academic perspective, some flavor, and also from little bit storytelling, like how this geospatial technology has been applied in the Nepal context. So I'm telling whatever is happening right now and giving my argument, like how it should be and what is my judgment. So this my presentation will be focused in that direction. So this is my overall bibliography, which has already been mentioned by Anmol. As it's already from the Abhas, Mr. Abhas presentations has already mentioned very clearly about the disaster cycle. It has this disaster management cycle. So it's the same way in my slide is also it's there. And this is particularly from World Health Organizations. And it's that means the WHO had already also mentioned that health is a kind of disaster. Now what is happening in now in COVID situation is now a disaster. So in this, we can already say there is a response, recovery, mitigation, and preparations. And in that, there is another cycle is like emergency restorations, which is comes with the response, and recovery is something in the reconstruction. Mitigation is kind of capacity building, and preparation pre-impact. What I would say in type of this disaster, basically I would say what disaster we are facing right now is health disaster. It's a COVID-19. So I'm talking, I will give my presentation just remaining in this disaster, health disaster, and focusing in COVID. So now we already know, like it's a it's a first, I will say, the event. Now its event is already there, has already triggered by this COVID-19, and it's intense due to a disruption to person economy, has already had economy, social, environmental disturbance, and also like, and what is COVID-19? I already said that disaster can be man-made or natural. So it's already controversial. It's a natural or man-made. It's a controversial aspect. I won't be going through that. However, it's a biological hazard, I will say. And if we see about some background, we'll share, which is already you all of know. I will not go so much in this slide, but we know that first it started from December 2019 Wuhan, and already in January 30. 2020 has declared public health emergency by WHO, and also in the, it has been declared pandemic on 11th of March. It's not mentioned here. And in Nepal, the first COVID was confirmed on 24th of January. 14th of May 2020 was the first death case the Nepal has faced. So, and now already you know what is disaster is. It's a function of hazard multiplied by vulnerability, which means if the hazard is there and the more vulnerable, the more risks towards the risks will be increased, and basically it turns into a disaster. So a disaster is a sudden calamitous event related to the functioning of a community. So when the community is started not able to cope with its own resources, then it turns into the disaster. In Nepal case, we can say maybe it's not so much disaster yet, because we don't have in the spread in the community level, but later on, if the vulnerability increases, then the risk increases, hazard is already there, then can be a disaster. It can, when it goes into community, it can turn into the disaster. The risk is already a probability of social, environment, economic damage resulting from interaction between hazard and multiplied by hazard and vulnerability in a given specific place and a time. So I will start with disaster reduction. Now, when you talk about disaster reduction, there's a set of measures and that is used to minimize the probability of damage caused by adverse events, such as label needs to be covered by the affected community with its own available resources. If the community can cope with its own available resources, that set of measures is as a disaster risk reductions. Now, considering in COVID, there's a disaster risk reduction. There's already a kind of social distancing, physical distancing, quarantine, isolations is already there. Now, I would say, like in disaster COVID, if we say response, recovery, and mitigation and preparedness. If we say like the disaster, like earthquake and flood, other type of disaster are triggering one time, it will come, and certainly it will start with the response, then recovery. But in this type of health disaster, it will take for a long time. So there is a blurriness in the phase of the disaster also. We need to respond, and we need to recovery, and we need to build mitigate. So it will come up in the kind of the blurriness, because it won't be for a trigger, won't be in the one time. It will keep on going for a long duration. As already we know that COVID is going for 2 months, or maybe we don't know how long. So this type of health disaster is a little bit different from the other type of disasters. So that is one thing. And already like medical, if we say from a geography perspective, there is already the terminology has been used in the health state, like medical geography and health geography. Means there's a realization of integration spatial data into the health. And to support this crisis, besides non-paramedical intervention, the application of spatial technology have proven to be more significant for delaying and containing the COVID-19 pandemic. This is what's happening. Now, if we come about this disaster and COVID, now I will come with this slide. Geospatial technology, we will say there's a GIS, remote sensing, and GNSS, satellite. This all comes for us as a geospatial. And terminology basically is GIS, remote sensing. These are the part. I will be talking more from the GIS perspective, I think, in this presentations. Now, I would go again, like if we see the application of geospatial technology in health, it has been found that in early 1964, the plague of contaminant in Italy that has been visualized by to the map. And also in the cholera in 1918, the communication of this also geospatial technology has found to be used from before as well in the form of mapping. So now, again, if I have some literatures, I have also put that reference at the end of my slide. So if we see the review of the GIS literature, it is already found that spatial analysis of the disease, spatial analysis of health service planning, public health, ethnology, and tools. In this aspect, the application of GIS has already been made. In the 2015 review paper has already shown. So now what is happening is understanding the spatial and temporal space and the change dynamics of COVID is essential for response, recovery, all phases of the disasters. Further, to support decision makers to government as well as the health professionals. Not only there may be other professionals there can be. So this is one of those that I did some study about the papers, and the source is this one. It has already found that for this COVID-19 application of geospatial technology in the study of COVID-19, this has recently been published in 2020, that is after COVID, that we can see that various countries had already applied this geospatial technology to have to study, to give research, or to response this health disaster of COVID-19. If we say about spatial and temporal analysis, like China, it's the biggest, I think, and health and social geography, we can see China is there, like some 8 to 9 publications has shown that China has already have this study in using GIS in this domain, and environmental variables, data mining, web-based mapping is the mostly you can see in Nepal. So environment variables, if we say like how COVID-19 is actually intact with other environment variables like temperature. Temperature is one of the things because it's already known, like if temperature is correlated with this COVID-19 virus or not. This type of environment variables correlations. For this study also GIS has been used. Data mining, lots of data, and how this contact tracing, this type of study for that as well. And like how the mobility, how the disease are spreading in the geography. For this as well, the GIS and geospatial technology has been used. So we already said the various countries are using this type of technology right now to combat this pandemic situation. Even in Nepal, I have also recently published a paper, and I can see at least 2 papers in this domain for Nepal as well. So now I will start with these things. This GIS, and like we already said, I've given here this website also. I will go to the slide. If we see there's a various dashboard now, you already are aware of this one. In the international context, GIS platform to combat COVID, John Hopkins is a dashboard which we already used to see like how this in the worldwide the cases are increasing, the deaths, and how it is spreading throughout the globe. World Health Organization dashboard, health map for analyzing online sources. So there are various already in the international context, web-based portals are there. These are the John Hopkins, WHO, and if you want to see, there is already a website link below. I haven't go through this one. So this is also one of the map that has been prepared to understand how the main like from high risk China, how the mobility has been occurred, and within this 15 days of before lunar year's day and 2.5 months following, in this period, what is the status of the mobility to the world, and what is the risk factors now, which country will be more risky from the COVID-19. So this type of analysis has been supported by the use of geospatial technology, I would say. So we can already say there's a lots of use of this technology. And if we see like the China, like I've read this one, like widow satellites are being employed for this to track the location of infected patients, monitoring cargo transportation to large scale distribution sites. And the use of technology in China contributes to substantial impact on limiting the spread of the virus and lowering the infection. So this is satellite continuous monitoring is also has been done in China. And in Nepal case, as already like we don't have so much geospatial strength yet, I think. So maybe Nepal will be having soon in near future. And also like also the UAV and drones are also found in various countries for transporting medical supplies, in spraying disinfection and surveillance, counting people during lockdown. These are the things drone has been used for this pandemic. Now, if we come to Nepal, in Nepal, we can see there's a various web portal is there. Ministry of MOHA, Ministry of Health Population has its own web portal, which will give the tracks of numbers, tested PCR, RDT, confirmed number of people, isolation, quarantine, these are the things, and hospitals, availability of hospitals. In the similar way, even Ministry of Home Affairs also have its own web portals. This is under the National Disaster Risk Reduction Management Authority, and it also disseminates the status of the COVID in Nepal and in district and provincial level, and also like various hospitals, various type of public health facilities also displayed in this two web portal in Nepal. And there is lots of mobile based app as well. I will skip this slide. So there is, I would say, there's a web portal, Ministry of Health Population. We are getting this daily here in Nepal, like what is the status of this COVID-19, number of cases confirmed, PCR tested, dates, and everything. And this is the map we can see, like distribution of COVID-19 cumulative cases in the different district of Nepal. And also, like we can already say this map shows that there is no exact cases in this district. There is no cases in this district. This is from the Ministry of Health and Population's website. But there is in ministry, I could not find interactive web portal. As in MOHA, in disaster, there is an interactive web portal where you can zoom, you can have province, district, you can feed, and you can you can get the information in the district level and in whole Nepal. There's a like quarantine, isolated, recovery. This is also the dashboard that has been published in the WHO and the similar type of that. But my query is that this type of geospatial technology is now helping in COVID-19 in response and recovery, and is still in the mitigations. This is Amro Shrestha, means our health. This is another app that has been given by the Ministry of Health. This is mobile-based app, and this is another government app. Also, this is mobile-based app. So you can see there's a lot of apps is there in Nepal. In Nepal case. And this is one of the Covira is a recently developed by the Science Hub, and this is the product of scientific research community, not the from government. This is, and there's a paper also has been published for this. And Covira actually gives you the status of individual risks as well as the regional risks. You can feed your information in the website, and you will get the information either you are how much risks in yourself, individual risks, as well as geographical risks as well. You can find out in this portal, like from this portal. So like, and also this is the map, like public health risks according to where we can already say Kathmandu somewhere is a higher risk zone. It's already mentioned. So this is the geographical distribution of the health related to public health, and also transfer risks. The COVID transfer risk map is there, and it's like COVID-19 is already, it said it's not about the individual health risks but death. It is also about the social and economic risks, because it's already like COVID-19 has already, this health disaster had already triggered the social and economic vulnerability of the people because of this job losses, everything. So this is how it's already is mapped, like which part of the country is more vulnerable, more risks, have more risks. Risks is the multiplication of vulnerability and hazard, I have already said. So now which part of this is more risks has been mapped by this COVIDA. COVIDA is a dashboard which you can, there's a link as well. It's easy to see and get the information in the real time. And this is also the this paper has also been mentioned by previous speaker Abhas. This is my paper that has been published. And in my paper, I have already mentioned like how UAB is given legal, there's a legal restrictions of using UAB in the disaster and the rules and regulations of UAB. However, in Nepal, we can already say this is the use of UAB. It's a small UAB. I found this pictures, but there's already a big in the YouTube also, like how UAB has been used to surveillance during lockdown, but not specifically in distribution of testing the swab. It has not been, I haven't found explicitly used in that domain, which we can use this UAB from that aspect as well, but have not used. But in the lockdown, like this army has been using to see the effectiveness of lockdown. However, it can be used in other health measures as well. And my critical reflection now is there is a lots of applications in Nepal, and it's a very similar kind and repeated. And so that's the one, which is and I do not say it's an effective and efficient use of those apps. And there's also now the suggestion is it should be used, the application of GIS should be needed to combat this post-COVID in the wider domain for the recovery, mitigation, and preparedness. However, we'll say like it's already, FAO has already been mentioned that after this COVID, there's a lot of other disaster, other kind of problems we'll be facing when Nepal, not only Nepal, throughout other country also. One of the is impact the food insecurity is the major highlighted domain. So in this setting, intervention in agriculture sector is needed to understand how the productivity can be enhanced. So geospatial technology need to use of geospatial technology in that domain is very necessary to combat or to increase food productivity in Nepal. And also like public health interventions, and because we talk about social distancing, there even like we don't see, but basically if we see the settlements in Nepal, we don't have so much planning city, but basically more vulnerable is the informal settlements. It's not possible to combat the public health measures like social distancing. So how to apply this technology to see like either public health intervention can be applied in that domain or not. That is also the another part of the sectors that need to be worked on. This is my paper which has already just published in the application of geoinformation technology. Here I have already given my argument that now geospatial technology should be integrated with the health. So health in all policy sectors should be there, and it should now be explicitly need to explore how geospatial technology should be integrated in the case of Nepal, and more. There is a lot of challenges that needs to be come back to integrate this geospatial technology with the health sector. Now, wider application, when talking about wider application in health intervention, like firstly is to increase the effectiveness of first aid by optimizing routes planning, how to move to the hospitals and victims, and what is the shortest route that can be made, that should be given real time. that would be helpful to combat this disaster. To track cause and areas of spreading diseases, which is already there, but I don't think so much. Like lots of, we can develop lots of model health-based models, geospatial models, to understand this type of spreading of the disease from main source to the different area. To take the location of health facilities, which is the where is the possibility, which is the suitable locations that is required, the location of the health facilities that can be done on this technology. And environmental impacts on health. Now it's already there, like only health is correlated with environment. So environment also impacts health. So there's a two-way around how environment impacts the health of the people. Like now, if we say, like, if there is no open space, even right now, if there's a congested place, there is a very high risk of spreading the COVID. So how this environment, how this planning sector can be incorporated to minimize the health risks, that is also one of the aspects where geospatial technology can be applied. And also, like, how the basic services are there or not, proper sanitation, health, drinking water, basic services. This is also the another part where geospatial technology can be integrated to help this in the health disaster reduction, I would say. Now this is another one research that has been done by my colleagues. And what he did is, like, in the food security, I would say, like how this is some images from UAV, and how that has been modeled, when applying different type of manure, what is the effect of that manure, that pesticide, in the health of the crop, like what type of pesticide will help in the productivity. So this is the what is research is about. And here that UAV has been used. The concern is now, as already said, when we use remote sensing images, it's sometimes a bit difficult to have access the high resolution image, and it becomes sometimes quick and easier to get it from the UAV. And so now it's already a research, like the research has been, it's ongoing, how this UAV can be integrated with the remote sensing to scale up this type of study, like finding out the health of the crop. Because I've already mentioned, when we talk about the food security, now we should have the geospatial technology from monitoring the health of the crop and how it can help in increasing the productivity. This is another paper that has been used for this COVID-19, and it's informal settlements of Africa as the two informal settlements. So what the study did is it has used the geospatial remote sensing images, and have done some analysis to figure it out, the public health measures like social distancing is possible in that settlements or not. If we see this, there's a various cluster, and the same color cluster denote that the health intervention measures like social distancing is not possible within this cluster, because these are the very compact settlements. So now, because this is the epidemic now we are facing, we never know, we need to might have to prepare other pandemic of this health. So in this, we can use this technology to monitor and to plan. And also, like, if we use the public measures, it's already said that this analysis already shows that this type of social distancing should be measured with the cluster. Now we say, like, brown area should be make one isolation, one quarantine. Each individual house cannot be taken as one, like in the isolation, or in the cannot be taken as a one unit. This whole unit should be taken as a unit for the quarantine. This study already showed this application of geospatial technology in finding out like how the public health measures can be applied. Now, other is what I see, the now issues Here, when we talk about geospatial technology, the first is like how to integrate with health policies, and that is another part. The other part I would say is about the challenges of GIS big data. When we already said there's a lot of big data, like how to take those big data, how to process that big data. That is another challenges in this type of health disaster using this special technology. The another is about ethical and legal challenge. This is the very now burning domain, burning research domain. It's coming up. Is like we talk about applying geospatial technology, but it should be integrated with ethical and legal challenges. Without that, that would be changed into another data disaster, I would say. So the thing is like when we talk about these issues, it's about this is the already a framework has been developed recently for the COVID-19 digital health public technology, and by this author we can already say there's a it's a kind of sunburst diagram mapping. So when it should be done, there should be a lots of things like digital inequality, non-discriminations, transparency. This type of aspects need to be included when we use the geospatial technologies as such in the health disaster. Considering this justice, solidarity, privacy, these are the main function, because in our we already said there's a lot of location based tracing, contact tracing app is there, and we never know like if how private and how ethical to take the location of the people in this pandemic situation, how the data will have the privacy, what will be the bigger legal domain that will cover or oversight or cover or prevent the data protection, what with the legal aspect to protect those data. So these are also the major things that has to be considered when we use this geospatial technology to combat the disaster, like I was right only I would just say like health disaster for this presentation, but it can be in other domain as well. So this is also the same slide that I have taken, like how these issues and recommendations has been given, but this is not limited to that. There is also other ongoing research, and I'm just trying to work with University of Bremen in this issue, like how it can be, what are the intervention is suitable when talking about geospatial technology, health related aspect. So these are the reference which I have used to prepare this slide. And I think I've done my presentation. Thank you and stay safe.
Perfect. Thank you so much for the presentation, for the insightful presentation on the applications of geospatial technology. And the floor is open for the questions. If anybody has a question, please go ahead. And meanwhile, I have some questions. Your presentation was really interesting. Do you think Nepal can use satellites which can complement geospatial technology, like in terms of gathering actual useful data, which can actually help Nepali farmers or Nepali urban planning departments to increase their efficiency levels, maybe in agriculture sector, maybe in the industrialization sector? And what do you think, like what resolution of pictures do we need for these applications? Because we need these applications in Nepal, and they are not so much used in Nepal right now, but how do you think we can progress from the state we are right now to the state we want to be?
Thank you for very good questions, Anmol. Yes, for us, it's we all as a researcher and when working with some project, always we are struggling is about the availability of data, and there are there are few data we can use Landsat, and sometimes that resolutions might not be so much appropriate for us when we work in the sector like in the urban context. We need high resolution images. So that is the part, and now that's why there is already use of UAV for the mapping, massive use of UAV that has been used for this domain. And now I can see, like as Abhas, Mr. Abhas has already, that's a very good presentation, and his the new intervention, like in launching satellites. And basically I will see this type of intervention, innovative approach, and this contribution can definitely will make Nepal to move to get that line which we are foreseeing, like using spatial data for in lots of domain applications, and without any this financial burden to get this costly images. So that I will say in by asking, because now for the research prospect we can get some data from survey department, but we need to pay, and sometimes it becomes not feasible for us to make a payment, and sometimes we can get for the university for as a some free approaches, free access. But we need to first, when we ask, when we think of doing some research, the first thing we struggle is like how to get the spatial data. That is always the questions that will be in our mind. And sometimes due to data non-availability of data, we will change the approaches, the methods we seek to, we thought of using that methods as well. So in many cases we have faced this type of problems. Yeah.
So the thing that you were saying, it's very interesting. You're saying that if you're trying to look for data, it's difficult to find that data, right? Whatever you're trying to find.
Sometimes like high resolution images, that is the things we need to, like when need to buy it, and
And
sometimes we
and if you approach the government for those kind of data, let's say sub-meter resolution data, or let's say 2 to 3 meter resolution, which is not free actually. How do you get those data in case of Nepal?
frankly, for me, right till now, I haven't tried to get the data from government yet.
I see.
But for
Okay.
from my student, they try to get the data for the saying that for the research purpose and study purposes, and that's the factor. They, because we are as in academic, so that is the thing. But when we like this data, for example, if somebody wants to use just for the project, then the cost will be so high that
Yeah.
sometimes that is the real challenge, I think, in this geospatial
So would you say in
domain.
the future, if we have a concentrated data center with
Mm-hmm,
all this kind of information, right? So if somebody comes, they need the
mm-hmm,
data, they get it. If there is a
mm-hmm.
concentrated server or a center that has all these kind of geospatial data, would
Mm-hmm.
that be helpful for you?
Yes, definitely. And I would like to point one thing, that in Kathmandu University, there is a one project is going on funded by World Bank, and it also has the objective. I'm not a PI of that project. My colleagues is looking for that project, and what is doing is developing a server, and as you said, the data concept server, where the different organization can deposit the data. And that would be make and from that server the require it's a kind of spatial data infrastructure or data sharing hub, I would say. And yeah, that's going on. But the thing is now, like the willingness of organization to deposit the data, that is one part, willingness. Since it's a project, it's a voluntary, it's not compulsory. Like if it's a government, then it would be a compulsory things. But since it's a like project bit, it would not be a voluntary. And the other is data privacy. That is the main, like the geoethics, geo-governance, geoethical issues need to be, now it is very important in Nepal as well to go in parallel, because like we play with so much data, and sometimes we'll never know like how the data will be used for what purpose. That should be very important, I think. And I'm starting in this aspect as well from the geoethical issues. That is one thing I would say, yeah. But as you already mentioned, that is very important. the centered data, because there are lots of data and then it's scattered and you never know from where to get those data. And there's lots of spatial data. The same data has been produced from different organizations, and the standard of the data, the quality of the data. This is very important to work on.
Right, right. So it's in a way, it's kind of ironical because we are talking about big data, but then the useful data seems to be, let's say, a percentage of it, right? So
Yeah,
you have a
big
lot of
data,
data, but then it's a noisy data. You cannot use
noisy
them.
data. Yeah, it's the metadata of data is very important. That is a very part, like otherwise it's kind of garbage in, garbage out.
I see.
If really, yeah.
Thanks. Thank you.
And I do have one question in follow-up to this question, like to the answer. Why do you think government has not taken any initiative to set up a data collection center? Maybe the government, like it can be incentive based. I mean, if an organization deposits some data, maybe the government can provide some incentive based on it and based on the amount of data. But why has the government not taken any such initiative? And if this data can be applied to so many sectors, why is it like we are still lagging behind? Do you have any idea?
I would say it's a policy. Maybe it's a policy driven, or because I'm not a government as such, so it's difficult for me to say like why government are doing or not doing maybe. But the thing is like as Abhishek already mentioned, it is very important to have a data hub and strong data sharing and very standard data. That is important. But I would not say like the questions like why is something difficult to give answer.
So I think
Maybe we
that's a very valid question, I would say. But I do know that previous government under Dr. Swarnim Wagle, when he was, I think, the VC of National Planning Commission, he tried to digitize whatever data there was. So, and in his push, I think data in Nepal started appearing too. So there has been some effort, but I would say it's not a concentrated effort. And if we are going to work with the government, yes, concentrated effort is needed.
and I think we don't have any questions from the participants. And I would like to also ask, like, how space technologies and like geospatial, because Mr. Abhas, you're the satellite project manager for Bodhi satellite, and Reshma ma'am, you are working in the geospatial technology. Like, how do you see these sectors collaborating with each other in future for effective disaster mitigation and preparedness? In
Dr.
context.
Sishoy, would you like to start? I think I can add later after that.
So your question like the collaborations.
How can we collaborate?
So like now first is collaboration from this we'll say like private company or between private or university, yeah. The organizational
in collaborations in general, like how these sectors can collaborate. I see these sectors are very two independent sectors right now in Nepal.
No. I would say like the organized, because collaboration can be in different domain. Like individual collaborations is there, academic collaboration is there, research collaboration is there. So it's so I've already said like for the university, for university as a researcher, I would say we need data. We need data. And if private organizations can handle that data, and that research outcome can actually give societal benefits, yes, and that societal benefits can be materialized, or that product can be we can say that is the research output is something intangible or tangible things we can get. So we'll say like we don't have at such buying the data is difficult for us if we say about the tangible things, and that is and collaboration is like because I think for the research various organizations will provide the data and will provide the data, and that contribution is something that scientific contribution is a product that really will have in our hand. So that is one I would say how we can go. Other is like maybe for some project or something. If there is a we can have a strength that we will have a data, then there is a very possibility of getting funding because we can say like there's something help in our hand. That is also the another part I will say. So maybe Avas can add more if he has
Yeah,
already said he will add. In
sure.
this part.
I think the major issue always has been availability of data. That's what I've seen now. And as somebody who builds satellite, the whole point of building a satellite is to provide that, to mine data and then give it, right? So, but what I see in case of Nepal is that we really don't need to start building, satellites. There are already
Yes, yeah.
constellations,
Mm,
satellites that are being built.
mm,
Open source data is available, just that we have to point towards those direction and show them to people that those data are available and
mhm.
show them how to use them. I think if we can just do that by showing what open source data are available and how to use them, and if needed we can use our connections to get high resolution data, then we can also implement that and then give it to researchers like Dr. Shrestha as well. So for us, it's more like we provide the data and show
Yeah.
how where the data is. And I think
Mm.
for researchers, they can then, sky's the limit after that.
Yeah,
Yeah,
yeah.
that is that is what we need is we need the data
Mm.
and
I see.
yeah.
It's very clear to me now. Like, so from at least from this discussion, what's clear is there is this huge need for a centralized system for data management. So you all the data, whatever drones, satellites, whatever, right? It has to come to one place so that anybody can come and take that data and then use it for something useful.
Yeah,
Yes,
yeah.
that is very important. Yeah, because so that we don't need to keep on sorting the data in various organizations, and data seeking takes time, and also like after getting data we really need to look into like either it's usable or not. So these are various
Mm.
parts, and if that is clear, then of course we will have a clear, as I already said, a clear sky to fly on.
Space to fly in.
Space to fly on.
Limited space.
Yes.
Perfect.
All right.
There is one more question. Could you share some source link to obtain the open source geospatial data for those who are interested to explore it?
Yeah, so what I can do is I can send those links to Anmol, and Anmol can distribute that later.
Yeah, I
So
have the presentations, so I
sure,
will send everyone the presentations.
sure. I can
And
send, and yeah, additional links as well. Like besides
yeah,
the presentation, I can send it. Yeah, sure,
perfect, perfect.
no problem.
So thanks a lot, and thank you. I think it's already we are 15 minutes over time. I think it was a nice discussion, and it was very insightful for me, and I think it was insightful for the participants as well. And thank you, Mr. Maskey and Professor Shrestha, for taking out the time to participate in this webinar and talking to us. Thanks a lot. And
Thank you.
we look forward to collaborations, like from NESRA also, we were invited to a high-level technical mission by UN Spider. So they had a mission by Digital Globe by Maxar. So we were talking about how we can provide data to Nepal with with respect to free channels, like with respect to channels that cost less than the usual things. So maybe we can collaborate in some sense and make a joint project and work towards building a better Nepal.
Yes.
Perfect. So I'll be in touch with you, and thank you so much.
Thank you, yeah, NESRA, for organizing this event. And yes, very well. I would also say it's very fruitful discussion. And Avas, Mr. Avas, thank you very much for the very nice presentations, very
Yeah, no
insightful
problem.
presentations. Yeah.
Thank you. Thanks all. Thank you.
So
Thank
thank
you.
you all, and please join us in the next webinar. We will have these webinars more often, so please join us. We look forward to your participation in our next webinars. We'll try to organize more webinars dedicated to disaster management and preparedness using space tech. Maybe we'll try to contact some other international organizations. So please do attend, and we can follow up on the discussions we have during this webinar. Perfect. So thank you.